Stay tuned. Stay tuned. Hello again, everyone. This is Eric Glazer, and you have logged in to our live recording of our next episode for the Bright Spots in Healthcare podcast, produced by Shared Purpose Connect. If you have yet to subscribe to Bright Spots in Healthcare, I encourage you to do so. Every week, I interview healthcare leaders who are experiencing unique successes at their organization. And we break down the what, the why, and the how so that you can ascertain if that strategy or tactic is applicable at your organization. I do believe wholeheartedly that being able to identify bright spots in healthcare and cloning them at different organizations across this big and vastly different country of ours and region to region is the most effective way of improving healthcare in our lifetime. So I encourage you to take your favorite podcast app, put in Bright Spots in Healthcare, click subscribe, and every Sunday evening we try to drop a new episode, and you can listen to it at your leisure anytime during the week. Upcoming episodes beyond today's show include How One Health Plans Investing in Housing for Their Members, and it will feature Amy Regal, the Director of Housing at CareSource. We also have another episode that we're getting ready to record that will drop in a couple of weeks entitled Reopening a Community Hospital During the COVID-19 Crisis, a live interview with Rich Fernandez, Chief Executive Officer at Beth Israel Deaconess Medical Center in Milton. Our topic today is entitled New Opportunities for Healthcare, Rethink Your Capabilities to Drive Value During Uncertain Times, and it features the one and only David Hanna. If you have not met or heard of David before, he is a partner in the HPO Global Alliance, a professional services firm committed to better understanding high-performance organizations and the methodologies by which they could be sustained and expanded. David has worked with clients throughout the world, North and South America, Africa, Asia, Europe, and Australia. His list of Fortune 500 companies is a who's who. They include Blue Cross Blue Shield, United Health Group, Walmart, Procter Gamble, Xerox, Böhringer Ingelheim, Roche, Raytheon, and many, many more. Prior to HPO Global Alliance, David had numerous senior level jobs, including serving as a senior consultant at Franklin Covey. And he also spent 16 years with a little known organization called the Procter Gamble Company. We are super excited to have him here to share his case studies and ideas on the Bright Spots in Healthcare podcast. Welcome to the show, David.
Thank you, Eric. Thank you. It's good to be with you.
Excited we could finally do this. Our topic today is Rethink Your Capabilities to Drive Value During Uncertain Times. So let me start with this very simple yet very critical opening question. David, what creates value in an organization?
That's a good question, Eric. The answer to that question has changed rather subtly and dramatically in the last several years. Back in the 1960s, a company's share price was determined at 90% level by past results and their hard assets. So investors looked at what have you done, what have you got, and then they decided to invest. But that 90% has eroded over the years, and now it's less than 40% is based on the past. And the other 60% is what one of the professors that's been involved in this calls intangibles. And the intangibles are your organizational capabilities, the strength of leadership, the amount of teamwork, the ability to deal with change, and the swift and efficient operation. Those capabilities now are what drive the value in the organization.
By the way, folks, you can ask David questions live through the Q&A module at the bottom. I think most Zoom interfaces, whether you're on a Mac or a PC, the Q&A module is at the bottom of your screen, it is on mine. We'll be monitoring that. Sherry Keels, our senior producers behind the scenes, looking at that. I am as well. Don't use chat to ask your questions. Use the Q&A module. It allows us to manage them a bit more effectively. So we'll be looking at that, at the chat for your questions. Feel free to ask away, and I'll try to integrate your questions either at the end of the show or right away if it's appropriate and on on point with where we are with our discussion. All right, so Dave, we're in a little bit of uncertain, chaotic times right now. How do healthcare organizations even begin to think about growth and prosperity when there's so much uncertainty?
This is a tough one. I would say it starts with vision, and it's hard to have a bright, futuristic, innovative vision when you have a lot of troubles and things happening to you. But this has been the common denominator. One of our examples is with the Merck company. The senior vice president of manufacturing, they were losing profitability. He decided we need to do something about this. So he organized an effort to improve and reorganize the worldwide manufacturing function. But two things: he gathered in other functions to be part of the process, not just his manufacturing people, marketing people, the research people, the quality people, et cetera. Had a rather large group, and then each person in that group was assigned to talk to 4 payers or providers that Merck worked with. And they had some questions that they had to ask them. So for example, what do you hope to gain by doing business with us? And what are we doing well? What do we need to improve? So they did that. One of the vice presidents, very thoughtful guy, later became the CEO at Merck. He said, I've been with this company 27 years, but I had never spoken to a payer or provider personally. And I asked them the questions, and they told me some things. For example, your pallet sizes are different than the rest of ours in the warehouse. And so we have to carve out an extra special space, and it takes time and, and all that. The shrink wrap on your product doesn't hold well. We have to rewrap a lot of what you send us. And each one is labeled, but the label is so small that you have to get right on top of it to know what it is. You can't judge from any distance what we're doing. So it makes our work in the warehouse a lot more complicated. Now, this VP said to me, he said, I've been 27 years. I haven't talked to anybody until now. And the things that they want, we can do, and it won't cost us anything. These are easy changes for us to make. We just didn't know they needed them. Well, you multiply that by several people interviewing different payers and providers, and the Merck organization gained a lot of insight on things that they needed to do. Some of them were more major, some of them more minor. But anyway, they had a great experience with that, and actually talking to their customers, payers and providers, was what sparked it. But the initial spark was the leader had a vision. We need to be doing better, and we're not going to let the hard times drive us into desperation. We're gonna take the right approach and really look at this thing.
Sorry, David, I always do that once a show where I forget to take myself off mute. 2 quick announcements before moving on to our next question. We had asked a lot of our regulars who attend our roundtables and our live recordings of the show how else we could help. And a bunch of you, especially on the payer provider side, asked around provided answers around how we could help streamline the due diligence process for you when looking at new technologies or solutions. And sort of on par with that, some of our technology provider friends wanted to get better feedback on their products and or the delivery of their demonstration or their product demo. So we're thinking about launching an innovation showcase where we identify a particular technology area that we know a certain sector is going to invest in, like a hospital system, and we'll identify like sort of a technology, let's say like revenue management software or solutions, and we will work with 3 or 4 leading vendors in that area to produce a the same formatted presentation, bring them all to the same session where they'll each present for, let's say, 30 minutes. And the providers in the audience could listen and ask questions. We'll provide feedback to the presenters, and hopefully be able to help save time and streamline the due diligence process for our providers. And in doing so, maybe there's some business relationships that result from it. So what we're trying to do, we're trying to take a careful approach to this, and we're forming sort of an advisory council. So if you're interested in helping me out and advising me on how that program should look and feel, I'm going to be sending out our typical feedback form at the end of the show here, where we ask for your feedback on different things that we could do better. And as part of that, we'll ask you if you want to set up a meeting with me and be part of this advisory council and advise me on how to shape this. So I hope you take the time. In about half an hour, we'll send out that survey by email, and you could sign up for the advisory council. We'll reach out and set up a meeting with me. Along those lines, I have a bunch of people who confide in me that they're looking for career changes or job changes, or maybe they're in transition. Most of them are employed. High-level folks, medical directors, social media leaders. We also have some really good tactical folks around database management, content writing. If any of you guys are looking to contract with individuals with those skill sets or hire them, I'm not a recruiter. I'm not looking to make money on this. I just want to connect folks and create a win-win type of relationship. So in that feedback form, you could click on if you want to be introduced to any of those people, and I'll check the feedback form, and I'll email you an introduction so you can meet folks in those areas that you may have needs, and maybe it helps and maybe it doesn't, but hopefully it does. All right, those are my two announcements. Let's move on, Dave, and let's talk about mindset and reinventing yourself as a company. So when you're considering such a progressive strategic modification during a scary economic time period, what are the questions you must be able to answer, and what should the mindset be?
Okay, let me start with the mindset. There's a professor who has studied, done a lot of research on what makes a high performance organization. And he's got a list in his book. This is Andre de Waal at the Maastricht School of Management in the Netherlands. He lists a number of things like management by objectives, building relationships, et cetera, et cetera. And he's got this long list of things. And I think most of us would look at that and say, yes, that's important. Yes, that's important. That's important. But the title he has over that list is, these have no relevance to high performance. And his point is, the individual points, if you take one thing and try to drive that through to get what you're after, you will be disappointed. You have to take a systemic approach. And each system may have a different combination of key factors that they need to be paying attention to. So let me just say that with United Health Group, client that I worked with, very large company. They kept growing. They kept adding product lines. They were happy, but all of a sudden, they would go into a prospective client. They would make a series of proposals from their different product divisions, and they weren't getting any new contracts. And when they talked to the clients, the prospective clients, the client said, well, yeah, it's too complicated to do business with you. You've got all these different people coming to us. We'd like to have one source that could help us move to something. So out of all this chaos, they found there were some organizational changes that they would not have chosen in and of themselves. So what they did, they created some integrated business teams, different product lines, different functions, not just development, but also marketing, customer service, et cetera, all wrapped up into one for each client. And so now the client was getting one group, united group. Whenever things were decided, those people would go back and they worked together very closely to deliver better quality stuff more quickly. And UHG started to grow again. They started to get new clients because, again, an untapped customer need had developed what they needed. Now, some questions to ask about that. This is kind of like what Merck did. what do our customers need to feel satisfied or excited or thrilled? What is it that they really want? Second question, how well are we doing at meeting those needs? Okay, and you get the client's evaluation on a scale of 1 to 10. How well are we doing the things that you said you really want us to provide? Okay, number 3, what things do we do really well? What do you admire about us? Number 4, what things do we not do well? Where do we need to do better? And get some help here. And then finally, if you could wave a magic wand, what 2 or 3 things would you change overnight? That gives you a sense of the priority through the eyes of the customer. And so United Health Group also did a variation of this. And this is where they found you're too complicated to do business with. You've got all these different functions and all these different divisions, and they're coming at us one at a time. And for us, it's not one at a time, it's 15 at a time. So they created these multifunctional teams, and lo and behold, with great product, with great people, with a simplified process that met the needs of their customers, they started to gain business again. And I will have to say, from my experience at Procter Gamble had the very same kind of issue when they went to these multifunctional teams working with each major client. They started to set a new standard, and it was starting to transform the consumer products industry.
Okay, so a few takeaways here. And I think it was a quote you taught me from one of your mentors, Andre DeWall.
Yeah.
That high performance doesn't come from individual initiatives. It comes from a systemic strategy, right? So
right.
One takeaway that I heard there. You start with your customers. What do they really need from you, and how well you're delivering what you're delivering to them, and what are the things you need to improve?
Right.
And then what would you change sort of tomorrow if you could, right? And that enabled UHG to sort of see what they had to do as far as integrating their account teams and create a better structure and a client experience.
Mm-hmm.
Wonderful. I'm going to take, there's a couple of questions that have come through the queue, and I want to get them because they do seem to be relevant to the last 2 questions. So the first one is, what are the capabilities in an organization? Why are organizational capabilities so powerful in defining a company's value?
Well, the organizational capabilities are all about action. It's what people are actually doing. And your results come from what people do or don't do every day. And so when you focus on the capabilities, you're either taking a strength and leveraging it, or you're shoring up a weakness with different behaviors and different actions that lead to success in the marketplace. So it used to be, what are the results and what have you got? Now it's, what are you doing and what are you capable of doing? What are your capabilities? I remember one company in the 90s, a high-tech company. They've been growing at 66% a year, tremendous growth. And obviously you can't keep that growth up forever. Well, the next year they were projecting only a 40% rate of growth, and their share price tumbled. Because to the market, they said, oh, you're not going to be capable of delivering what you have been delivering, and so you're not as good a bet as it was before. So the organizational capabilities, and I can send a list around of things, but it's, your connection to the customer, the quality of leadership, the ability to have teamwork, the ability to change quickly as times and market conditions change. So it's a whole number of things. The efficiency with which you do your work, your cycle times and things like that. That's what people are paying attention to. That's what customers want. And that's what investors are looking for as well.
So, and then next question from the Q&A module, and folks, keep them coming in. This is going to clear the module up right now, so it'll be clear for you if you want to ask a follow-up. What if some key customers want you to do something that you feel is not core to your business?
Very good question. Okay. Each company needs to be very clear about what its business is and what it is not. And as new requests come in, you need to consider, is this something that we want to add to the mix? So in the one question to ask by such requests, how important is this to us from a cultural standpoint and from a business standpoint? I remember one retailer who was very successful, offered great quality, low price, fresh merchandise. And somebody said, well, you know, why don't you have, there are a lot of products you don't have, and we want you to expand. And the management team looked at it and they said, you know, the reason we can give you the lower price is because we don't have 5,000 SKUs that we have to carry in the store. We are focused. What we do bring, it's above, but if we started to bring everything, then we couldn't do that. And they said another thing, we want you to go to the competition for other items. We want you to see what they're doing. We want your feedback on what you see there to tell us what we need to be doing. So anyway, that's one thing. How important is it? And another one is, how do we want to be viewed by our customers and the public at large? And that particular question, there was some research done some years ago. Professors studied the mission statements of the Fortune 500. They only got about 67 respondents. And then they analyzed it and they said, okay, there are 8 areas that are covered in these mission statements. They're all, you know, basically the same in terms of topics. But they then looked at the most profitable companies, and the 25% most profitable companies had 2 questions that the others did not have. And the one was, what do we not want to be known by our customers? And what do we not want to be known for in society? Those value questions were causing everything they did to be at a higher level than the others.
That's fascinating. Great stuff. This is great stuff. You know, quickly for everyone, and remember the Q&A module's there. Actually, David, I'm getting some requests. By the way, my module is over on the second screen. I'm not looking away from everyone. I'm just looking at the questions. I've got 2 of our attendees asking if we could send them the questions that you just referenced earlier. Is that possible? We could write them up?
Yes.
All right, so we'll try to include that in a follow-up email to everyone. We'll get you a list of questions, those list of questions from David. And incidentally, we're planning an online course featuring David as the instructor. We're calling it Increase Value in Your Healthcare Organization During Uncertainty. And it's about strategies and tools to empower your team to achieve breakthrough results. Now, if you've ever taken an online course, it's asynchronous. So the lessons will be distributed in sort of like a Netflix. You could binge take the lessons, or you could take them periodically. There will be some homework to do that furthers and ensures you are learning for all of this. David has done this before in different formats, and we think there's a lot of really valuable lessons to be learned. So we're planning on launching this course in August. It will include asynchronous courses. It's going to include access to David through email and online discussion forums, and he will get on the phone with you one-on-one as deemed appropriate and needed. We're going to charge about $3.99 or even more for this. But anyone on the call today that wants to be one of our Pioneer students, we're going to just for you guys, if you want to join and enroll, $89 for all of you. So it's basically something like a 74% discount off the tuition price. So if you see the poll right there, if you want to get more information, the syllabus, and a link to register for only $89, just click on yes. Click on no hard feelings, completely understand. And, you know, I think this is a really valuable strategic lessons to be learned from David, especially during this unusual time period we're all working through. So press yes of the poll if you want us to send you the link to register and the syllabus. All right, David, let's move on.
Can I just add one PS to the course? A lot of what we'll be doing in the course will be allowing you to apply what we're learning to your specific responsibilities in the company. So there'll be a lot of application, and you can personalize it to your own situation.
Well said. We'll keep the poll up there for a little bit as we move on to the next question. Sherry, I'll cue you and we can turn it off. But let's, folks, again, don't worry about saying no. We won't ban you from our future shows. I totally understand it's not for everyone, but I think there's a lot of value here, and that's why I agreed to help produce it and promote it. David, let's move on. And on par with some of the things we just talked about, when you say a systemic change, it feels a bit overwhelming. We've been talking a lot about external facing questions to drive change and strategy. What is the approach you must take to look internally at your organization, and how does this influence strategic thinking?
Okay, yes, good questions. First of all, I'll go back to Andre Duvall. You've got to take a systemic view, but that doesn't mean it becomes overwhelming. And we've seen with our clients processes that enable them to take a very holistic picture of all that's going on and break it down into the few priorities. So let me give an example. Beverly Healthcare, now Golden State, the owner retired and sold the business. Back in 1999, the government had changed how they were going to reimburse nursing homes for their fees and charges. And the new rates were going to reduce the revenues by about 17%. 17%. Most nursing homes operate at a very low margin. A lot of nursing home companies went out of business when this came in. A lot of them were just, hanging on by their fingernails. And my client, this Beverly Nursing Group, was very, very much struck by this. Now, they had done a lot of work with customer research. They were very devoted to their customers. They were wonderful people. Now, so what did they do? They looked at, okay, the government expects this. Our clients need top care. How do we do this? And so they did a diagnosis. They took, if you will, a health checkup of their organization. And in the course, we'll be getting into the specifics of how they did that. But three things that they found that were very critical. One, they found that a lot of their employees were burned out. They were getting sick. They were fatigued because they had minimal levels and high workloads. And so that was one thing that came out. Another was for several of their systems, they were disjointed. Each department was ordering this or ordering that for what they needed, but nobody was looking after the whole. And especially in ordering medical supplies and inventories, they found that they were spending a lot of money needlessly. A lot of it was being wasted. And then the other thing they found was that for each shift, the work was assigned by department. So department had 10 people, 20 people, whatever it was, those 20 people showed up to the department, regardless of the workload. So other departments didn't have enough people. Some departments had too many people, but on a given shift, nobody was quite right. And so the burnout was accentuated in those cases. So the group that looked at this, headed by a vice president and key people involved, they came up with a plan. First thing we're going to do is we're going to redesign how we order our medical supplies, and it's going to be done on a facility-wide basis, not each department ordering their own. Departments submit to us, we reconcile it, and we send it on. That was going to save an enormous amount of money, they found. The other thing that they were going to do is when people show up for work, the assignments will be made based on who has what needs. So if I'm a CNA or an RN and my area has got more than enough for tonight, they're going to transfer me to another area that's shorthanded. So this was helping the burnout. This was helping the assignment of work. The other thing that this recommendation was to help, again, further with the burnout, we're going to actually add a few more heads on each shift. So while everybody else is further cutting to the bone, they're adding a few people because what they saved with the other things more than made up for the payroll of another 6 or 7 people per shift. Bottom line, their proposal was going to reduce their costs by 30% to offset the 17% loss of revenues that the government was imposing. So see how it was systemic. It was based on their values. They have very high values for serving their customers properly. And when it all came together, they more than met the requirement that the government was going to make.
Wow. So I would listen, this is from one of our audience members. I was going to maybe ask the same exact follow-up in a different way, but this is what this audience member just submitted. I can't imagine a nursing home company actually increasing staff when their margins were cut. How did they come to choose that? So I think everyone's probably asking the same question in their head.
Well, yeah, the reason they came to it was in their diagnosis, there was the whole burnout thing. That was a serious problem, a lot of absenteeism. And then they saw when they got it all together, see, intuitively, they wouldn't add staff. But when they got the burnout, the ordering of supplies, the assignments by shift, when they got all that reconciled and streamlined, they had actually much more to play with than they thought. And so that's why they did it, and it worked. So I mean, these are real numbers. They had a 30%. The executive team, when they got this proposal, they were astounded, and they all supported it because it was consistent with their values as a company. It was consistent with the business needs, and it was innovation beyond what most companies would be able to match.
Okay, here's another question coming in, and this is really, Peter, thanks in advance for asking it. I am a big believer, everyone who comes onto the show knows I talk about bright spots and positive deviance a lot. And the philosophy around positive deviance is it typically those sustainable changes tend to be a bottom-up approach. Everything you're talking about right now seems to be a top-down approach. So the question that Peter asks is, your solutions seem to rely on management making top-down decisions. How do the workers accept this sort of management?
Very good question. At Procter Gamble, we did a lot of research on if we were trying to develop better and higher performing work teams in our plants, we would visit model plants of other companies that would let us come in and learn from what they were doing. And so we would often take hourly people, technicians with us on those visits. We had other Procter Gamble plants that would send their hourly people to talk to our hourly people. No managers involved, just give us a straight scoop. And from those, the workforce became excited about what they heard. Now, in the Beverly Enterprise situation, they had the input as they were doing their diagnosis. They had the input from the employees saying, you know, we're burned out and all that kind of stuff. So when they came out with these changes, we're going to move the staff where they're needed. People understood, oh, this is relieving somebody else's burnout, and I'm not being affected by it. So they bought into it. Many of these changes originated not necessarily at the owner or senior vice president level, but at a department manager who just in the department, he's trying to figure out, or she's trying to figure out, how can we do things better that's going to make things work? And if they're worth their salt, they'll talk to their people and say, well, what are the issues? You know, those questions that I read off before that Merck did, I'll also send you the internal stakeholder version. And I'll just I'll count them here real quickly. Question number 1, to employees, what are your priorities? No adjective, not business priorities, not personal priorities. What are your priorities? One organization, no one in the organization mentioned, this was an R&D organization, no one mentioned better meeting customer needs. Can you imagine a whole research and development function where no one counted that as one of their priorities?
Yes. Yeah.
You know, we had senior management almost wanting to commit hara-kiri. They couldn't believe it. But anyway, so what are your priorities? Secondly, what things help you achieve the results you're getting? What things are barriers to your progress? And if you could wave the magic wand, what 2 to 3 things would you change overnight? With that input, they know what the mentality, what the sentiment, what the emotion of the employees are. And when they, and a lot of these people use employees in the design of the changes. And then when they come back, they've got a peer they can go to the water cooler. Well, what's with this new program? Well, listen, I was there, and here's what. When they had those discussions, people were just unanimously ready to go with it and embracing it.
Great. Hey, I just noticed in the chat, a few people had said they couldn't answer the poll when it was up. If you had any trouble being able to answer yes or no, and you want your answer to be heard, especially if it's a yes, right? Because that means you'll need a follow-up from us. Post it in chat. Just say couldn't. Yeah, just say yes. If you've already taken the poll, don't write yes again in the chat. We'll capture that through the poll. But if you weren't able to click on the poll for some reason, just chat it to the panelists or to me, and we'll capture it and we'll add you to the queue to follow up with. Let's move on, David, to this question. Often we focus on what's not working. How can organizations on the call today raise the bar on their strategic initiative by thinking differently?
Okay. This is an example I experienced with the division of Procter Gamble's research organization in the healthcare division. There have been some very disappointing things coming out of this division. A number of patent infringements where competition was saying that Procter Gamble had infringed on their patents. It went to court. The court found that Procter Gamble was, in fact, violating the patents. And this had grown to the point that Procter Gamble was paying about $4 billion a year in fines. And so I was commissioned with a department head of a director of our R&D to find out what's going on. So we did our systemic diagnosis. And what we found was there was great pressure from management to get a new product out on time. And the timelines were set far above and away from the people that were actually doing the work. So, you know, we want you to leap tall buildings in 3.5 hours. Kind of thing. So there was a lot of pressure to meet the deadline. And anything you did to do a patent search was going to slow you down. And when we interviewed attorneys that worked in the division, we interviewed leaders in the research side, and we were hearing the same story over and over again, except in one area, in one product area. That was not the case. And so then we paid attention to what we heard in those interviews. Very simply, the project leader in that area would not send a project forward unless he had a complete patent infringement analysis.
Okay, hold on, time out. I'm going to take a moment. So this is a perfect bright spot scenario, right? So
yeah,
everyone listening, this is
we found one that was doing it. Nobody else was.
Everyone's doing, rather than focus on all the things that are just going wrong, causing this $4 billion bill. You found the one department that actually was doing it right and figured out. I'm sure you're going to get into it now, but this is exactly what I'm talking about identifying bright spots. This is an internal one, of course.
Yeah.
Keep on going. I'm loving this.
When we talked to this person's subordinates, they said, well, this really hasn't been a problem in our area because, you know, Jim doesn't let anything go that's not been fully checked out. And we have to prove that we've uncovered all the stones and we've looked at everything that's out there. And in other divisions, in all the other parts of this division, everybody said, well, you know, we just don't have time to do a thorough search. And those attorneys, they take up so much of our time. We don't, some of them, the attorney and the product leader had their office in the same corridor. They never spoke to one another. So, you know, you can try to bring the collaboration, but when the culture is against it, it's not going to go anywhere. And so that's what we found. Now,
that's human
my colleague, the director and I, we present to that division's vice president, that division's group vice president, the general counsel of the company, and we present to them our findings. And they were absolutely speechless. They said, you mean all we need to do is have all of the product leaders enforce the company policy? Because the policy was the leader has to sign off on it personally before it goes forward. You mean we just need to insist that the leaders follow the company policy? I said, yes. Well, the next year they had no patent infringements. They had no fines to pay. A very simple thing, but the culture had turned away from it. And that's one of the things that we'll get into in this course, how culture often drives the wrong things and is more controlling than all the careful work that's been done to get success.
Is that a was that a new sort of eye opener for P&G? I mean, they're a company that has thrived through generations. Are they inherently looking for benchmarks and people who are doing things well throughout the organization or even outside of the organization?
They do. I think what was working against them in this case was the high level of emotion and fear of not meeting the deadlines. I think that was making that in and of itself was causing good people to do really bad stuff.
Do you have an example of what do they just look internally because they're so big at different departments doing things unusually well, or do they also go outside of their walls to look at?
No, we would go, like I said, to competition that would be willing to let us come in and look at their strength of their quality system or their management structure or their management development programs, things like that, if they would let us in. If not, we would go outside our industry and we would look. You know, I'll tell you for an example, one of my past clients is Ritz-Carlton Hotels. If you want some mind-boggling ideas on how to run a better hospital or to how to better serve your customer, do as I did and go study the Ritz-Carlton system in detail, and you will find, first of all, it's very demanding. Secondly, it's very legitimate, but their motto says it all. For a Ritz-Carlton employee, we are ladies and gentlemen, serving ladies and gentlemen. And what I observed in numerous situations was those employees were treated like a guest in the hotel. And when somebody needed help, they often didn't even have to ask for it. If they saw that somebody needed help, they would rush in there and they would help.
God, now you got me like, we got to do another show with with you and someone from Ritz-Carlton. That would
I tell you, it was, well,
really cool. Yeah, that would be really cool. I guess we got to, could we include some of the learnings from the Ritz, for the providers that joined the course? Do you have things that we could incorporate into the course that would allow them to learn a little bit more from one of the, probably if not the highest appreciated brand around customer engagement and service, right?
Yes, yeah. Yes, we can include that in the course. I also have a book, Leadership for the Ages is the title, and one of those chapters is devoted to Ritz-Carlton. And I've had the senior vice president at Ritz-Carlton and the president, Horst Schulze. They told me, no one has ever told our story better than you have in this book. So we can do it live, but there's also that book that we can recommend to you.
Great. Folks, just a quick reminder, your feedback form's coming into your inbox in a couple minutes. Please take a look at your inbox. I'll be bothering you. You get more emails from me. It takes 2 to 3 minutes to take. Just check. We really appreciate it. It drives all of our programming, as many of you know. Question from the audience, Dave. And there's a couple of these around this. We'll rattle off a few in the remaining time we have. How to shift the culture to follow the company policy without employees seeing you as harsh and in turn hurting the culture more?
Well, okay. This is a good question. What are the consequences of people not following the policies? That's a question to ask. In our settings at Procter Gamble, we did a lot of annual customer surveys of our employees. And we found in many cases that one organization, we would do one of those about every year and a half. Interview a lot of employees along the questions that we talked about. What are your priorities? What things help you? What things get in the way? What would you change? And we always found in those studies, 18 months apart, some new issues had come up as front burners. But we were able to jump on those and address them quickly before they became really slowing us down and bogging us down. So I guess one of the things that we found is if you can identify what are the consequences, how much does it cost? Well, in the patent case, it was costing $4 billion. Isn't that worth some more discipline, not harsh, not dictates, but there's a policy there for a reason. Is it unreasonable to expect a product leader to make sure we're not going to infringe the patent? In other cases, we had people who were sloughing off on the job when their team became aware of, do you realize what that's costing you in terms of product efficiency, in terms of burnout for the rest of you? Those teams took it upon themselves to help their slacking team member get in line. So yeah, it's not harsh. It doesn't have to be harsh, but it's real. What are the realistic consequences of not following those policies? And if you can back it up in dollar or in negative impact on the employees, then you build a coalition of support.
Fascinating. Harder to do than to say, but I get
harder to do than one can say. But believe you me, people can understand when you're just mouthing the words and there's no teeth behind it. As one person once said, if you want to know what's important to management, don't watch their mouth, watch their feet. What do they do? And if there are consequences, the consequences have to be clear.
So, good segue. Why does it take so long then to drive organizational change, or changing the habits and structures within an organization, and what are ways to expedite the time?
Okay. Well, first of all, we've already mentioned when Andre Duvall says we pick a single item, a new project, a new hit thing, whatever's in the literature or whatever somebody up high says this is something we ought to do. We pick them off one at a time without, this is like walking into the doctor's office and you say, doctor, I've got a back pain. He said, we need to do a kidney transplant. What's the diagnosis behind that prescription? I've been limping lately. Well, we've got to do ankle surgery with no diagnosis. So when you pick off a list, oh, let's try this, it may or may not be relevant to what you're doing. But even if it's relevant, that single point is not going to make a difference. And so that's one of the things that slows it down. Secondly, and one of the questions alluded to this, how do you get people on board to buy into the change? How do you do that? Well, again, what are the consequences, and do people know what those consequences are? And I will say this: we did have one situation years ago in our Charmin toilet paper section. On the Johnny Carson show one night, he said, "Have you heard about the shortage of toilet paper in California?" Well,
he was ahead of his time.
Overnight, this is in the 70s, overnight, toilet paper was off the shelves. People hoarded it. So in our toilet, in our Charmin plant in Georgia, we went to a 7-day schedule just like that. Now, this was hard for people, but our product was on the shelf when nobody else's was. And our market share in California stayed very, very, very high, much higher than before. But the only thing that people who had made that sacrifice, the only thing that they heard was, well, the needs of the business mean you have to work. And they said, why are we, and I said, isn't it a crime that the people that had really made sacrifice, but it helped the business exponentially, nobody helped them understand that connection. So I think if you had asked those people in advance on those circumstances, they would have given that time. They would have done it. But when it was just an order for the needs of the business and it wasn't identified, they were quite disappointed till they found out. Later, they found out.
Love these stories. So folks, looking at the queue, one more question to clear out. So we have some time left. If you want to ask a last minute question and get it into the Q&A module now. Sherry just posted the link to the survey as well, if you haven't gotten it in your inbox yet. So please provide that feedback to us. So David, cutting corners is becoming more commonplace, especially today, where people are just living in fear. So, doing things faster, trying to be faster, trying to save money. How do you guard against this? And how do you guard against it?
This is something that has not changed overnight. This is really kind of a summation of everything we've been talking about. You have visionary leaders, you have close contact with your customers, you have the organizational capabilities of teamwork and collaboration and adapting to change. You have all of that in your favor. If you don't have that in your favor, you have to develop the culture from scratch, and that takes a long time. I've had companies come to me and say, we want to go to this high performing model, and we're far from that today. What do you think it's going to take to get there? I said, minimum of 3 to 5 years. Oh no, we need it tomorrow. Well, I'm sorry, but drop down and give me 75 push-ups. Can you do that? Some things you can't just do with a flip of the switch or with a verbal command. So usually the culture development lags behind the direction, unless, like at Merck, like at Beverly, like at United Health Group, a lot of the change that was done with widespread participation from different levels, from different functions, so that people knew, here's why we're making this change. Some of the changes weren't time consuming to make, they were time consuming to get everybody on board. But if you have enough, what I call them, ambassadors that were in on the discussions in the room, we had ambassadors in the room who understood at a deep level. They could, at the water cooler or in the locker room, they could discuss and fill in what maybe had not gotten through to everybody.
Thank you for all this.
But there is no shortcut or quick fix for many of the things that are going on in the organization. Take a systemic approach, have the vision, have the guts to stick with it, and it'll come.
If you are listening to this via recording and you want to get access to the document with the list of questions that we're going to send out to everyone who's attended live, you can email me at eglazer@sharedpurposeconnect.com. I look at all my emails. Doesn't go to an admin, it goes to me. If you need to, I'll forward it to David. We'll get that content out to you. If you want to be considered to take the course at the pioneer rate of $89 after listening to this recording, email me at eglazer@sharedpurposeconnect.com. We'll get you enrolled in the course. We'll get you information so that you could decide to register and enroll. Subscribe to Bright Spots in Healthcare. This episode and lots of others are already in the queue or already up there. I want to thank my team. Those of you who know me know that this is not my day job. I actually have a day job with Teladoc Health unrelated to this program. And so the only way I'm able to produce this great programming is the team behind me. I've got my senior producer, Sherry Keels, who does a lot of the incredible content development for us. Amy Raymond with our promotions and marketing, and Rohit Patel with a lot of the management of the database, and Kim Grass, who does everything that no one else does for me. So I just want to thank the team, Cesar Del Castillo, who edits and produces the podcast with me. Thank you in advance for all your work, guys. And David, a special thank you to you. Great job today. Really appreciate it, and look forward to working with you in the future.
Thank you, Eric. It was my pleasure. Thank you, everyone. I hope this was helpful to you.
To all of you who took the time to attend, I feel, even though we don't charge for this, an hour of your time is an incredible privilege. We hope to continue to earn that hour. Please take the feedback survey so we can continue to customize our programming for topics that will be most valuable to all of you. This will mark the end of the show. We have our next show coming up the second week of June, when I interview the Chief Executive Officer of Beth Israel Deaconess Medical Center in Milton, Rich Fernandez, about how he is opening up his hospital during the COVID crisis. So we look forward to seeing you during that live recording. Thanks, everyone. Have a great day. David, thank you. We're still on. I just stopped the recording, and I'm going to log us off. If you want
Okay.
to, I'll send you a link. We could reconnect through another link. All right.
Okay.
Look to your inbox. Great job. Thank you.
Thank you.